Hi everyone, welcome to the second episode of the National Medical Stores podcast. My name is Shilan Ruchile and we're glad to have you yet again. Now, for this second episode, I am joined by a man that is at the core of the NMS operations, Mr. Paul Okware. Thank you so much, Paul, for joining us.
Thank you for having me here, Sheila.
Paul, what do you do at NMS? If we could start with that.
All right. Sheila, I have been fortunate to be with NMS now for almost 10 years, and I have been serving here as the head of stores and operations.
What does that look like?
Stores and operations is the largest department in the organization. It's responsible for making sure that we can receive, warehouse, and distribute essential medicines that we distribute to public health facilities across the country. So over the years, I have been responsible for making sure that the operations in receipt, stock management and distribution are in line with our mandate, with our promise, and we try as much as possible to be making those deliveries within the delivery schedule that we pre-publish.
Okay, so maybe just to help the viewer, in less than 30 seconds, what does NMS do?
I think that people pretty much, know. We keep telling them it's procure, store and distribute essential medicines and medical supplies, primarily to public health facilities. Okay. So we are a government agency, and we were established with the purpose of making sure that we can have essential medicines available in government-owned facilities. So we have these premises here, we have these staff, we have these vehicles, and that you see on the outside, primarily to make sure that we can serve that purpose and mandate. And we come to work every day to try and do exactly that.
Okay, so we have these premises here. Where are we now in terms of the current location? And just what is the capacity here?
The footprint of the NMS operation is quite wide these days. We used to operate out of about a 4-acre piece of land in Entebbe, which we occupied for quite a while. But recently we have been able to establish this very large 30,000 pallet location warehouse in Kajansi. We do maintain operations on both sites just to try and make sure that we can accommodate the volumes of medicines that we are putting through the system. So for today, we are in our brand new 30,000 pallet location pharmaceutical warehouse in Kajansi. We are very excited to have this place fully operational now, and we have quite a number of orders going to health facilities across the country coming out of Kajansi here.
Okay, what was Entebe's storage size?
It was about 8,000 pallet locations.
So what does that mean for our NMS capacity, but also what does the 30,000 pallet positions translate to?
So there are several things we need to try and appreciate also in the nature of operations that we have. We are a distribution entity. So when we have 8,000 pallet locations, that allows us to be able to hold a certain volume of buffer to receive orders and fill those orders. When we established a 30,000 pallet location warehouse, that gave us nearly 4 times, or almost 4.5, close to 5 times the volume of space that we had. That means we can hold deeper buffers. That means we are able to buffer supply side fluctuations in availability of commodities, but also we're able to respond more readily to escalations in demand in case we have epidemics, outbreaks, or just even upsurges of particular kinds of morbidity across the country. So what it does from a health security perspective is give us some sort of cushion. Health is a very important aspect of national health security. And by having this warehouse available to us, we are able at least to make sure that we can cushion the effects that health issues can bring to the country.
Okay, now there's been one major question around either absence of drugs in hospitals, and yet when you walk into this warehouse, it is full.
Yeah,
it is full to the brim. What does that mean, and how should they, the Montua once again?
Yeah.
How can they make sense of that? That there's a lot of medicine in the warehouse, but then when they go to the health facility, sometimes they complain that there are no medicines.
Yeah, I think important for us to appreciate the scale of our operation is increasing year on year, in keeping with the population increase that we are seeing in this country. This entity is more than 25 years old, and you can imagine the population of this country, I think, has more than doubled within that time. So there is already an innate demand for these commodities that we distribute. But also we must be aware that technology is also improving every year. There are new formulations that are being made available that people can access. There are actually new therapies that we are making available. There are new programs that we are now serving to make commodities available, which were not available before. So you start seeing an increase in volume of commodities here. Recently, we are just distributing nutrition supplies across the country, which is very important for us. We support a lot of projects across the country as well. You'll see us sometimes even distribute wheelchairs, weighing scales, and so many things that may be on the periphery of healthcare as you may know it when you go to a health facility to get medicines, but there are other things that support health in this country that we are a very big part of. I think one of the most notable projects that we have recently supported are the bed nets, where we distributed about 28 million across the country. All that inventory here that we hold supports the health sector, but may not necessarily translate into commodities that you may be seeing at the health facility when you go there. But I think also important for us to note is that whereas we see these volumes of medicines here, it is also a reflection of the health habits of the people for whom we are providing these commodities. If we have a population of people who have very poor health habits and are not taking the message that we have been preaching over these years of preventive health seriously, we end up with a very high morbidity burden, which requires a lot of commodities. And I think that is not the right question we should be asking. I think what we ought to ask is, how frequently am I going to the hospital? How well am I taking care of my health? When I was provided a bed net, do I make sure that myself and my family sleep under it so that I can reduce my frequency of going to a health facility seeking for remedies to treat diseases for which preventive action is available, preventive behavior can be taken to make sure that it can be avoided. So I think it is in tandem with the population increase, but also the service offering that we are providing. The range of commodities that we have available to us that we're providing to the health facilities is expanding every year, but also there's a reflection of the health habits of the people we serve. I think there's a degree of responsibility that we need to start seeing with our people.
All right, so what kind of medicines does NMS provide, and to which hospitals?
Okay.
Or which health facilities, for that matter?
Thank you very much for that. We provide a very wide range of pharmaceuticals and related medical supplies to health facilities across the country. But the means by which they can be able to get them is based on the level of care. So the Ministry of Health has designated health facilities based on the level of care, all the way from 2, 3, Health Center 4, the general
That's
hospitals.
Health Center 2,
Yes.
Health Center 3,
Yes.
Health Center 4?
Yes, and they will all provide different services to the populace around them. So based on that level of care, they're able to access a certain range of medication from us here. Important to note also is that we provide more than close to 30 different therapeutic groups of medicines that they can access. But then that has to be within the level of care that they're operating. We don't expect Health Center 2s to be asking for theatre materials because they will not have one. We don't expect the Health Center 2 to be asking for items to perform deliveries, because we expect that to be a service that will be starting from Health Center 3s.
Oh, that's interesting, because I know that the Ministry of Health, like you said, designates each health facility to handle a certain degree of a case, for instance.
Yeah.
But then we have many people who go to Health Center 2s and they want to deliver.
Yes.
And when they don't find medicine required for delivery, then probably that also contributes to the no medicines in health facilities.
I think you raise a good point there, but we also encourage them still to go to those facilities. The first fundamental in public health is to make sure that there is access. So if somebody has a health condition, or for example wants to give birth and the nearest facility is a Health Center 2, it is still important for them to go there. But we have a referral system in this country where if you went to a facility and the service you seek cannot be offered there, or the professionals are not available and they're in another level of care, it's very important that you get referred. So it's also important so that we don't all crowd the national referral hospitals or the regional ones or the general hospitals, but at least we can cascade people up the stream based on the services that they actually seek. The commodities that we distribute to the health facilities across this country are essential medicines. What that means is not just an English word. Essential medicines meaning that they're derived from the essential medicines list of Uganda. That is the list from which health facilities can select items that they will plan for within the financial year.
And who determines the essential list of Uganda?
That is the Ministry of Health, in consultation with facilities and experts also in different fields who treat particular morbidities across the country. So their expertise is brought together, and we came up with an essential medicines list. It sets the boundaries within which we are going to treat people of different diseases in the country. It also provides guidance on the dosing that shall be given to treat particular illnesses, which is very, very important in this country because we still have a lot of issues around polypharmacy or even just improper
What's
prescribing.
polypharmacy?
Polypharmacy is a phenomenon that we see very common in Uganda, where people get a wide range of medicines to treat ailment which would be treated by a very narrow range. So if you've got a simple case of malaria, people would give you the anti-malarial and perhaps a painkiller for the headache that you may have. But someone may see fit to start giving you other medications that may not necessarily be necessary.
So
I start
instead of
giving you a
going with,
dewormer,
yeah,
I start giving you some multivites, I start giving you some other things that may not necessarily be necessary to try and it's normally done to try and increase sales in the pharmacy business, but also to give a doctor some kind of credibility that he's covered
That
all
is-
bases, which is a very
I know that
dangerous
there are times you've left the
behavior.
hospital and you have like 10 different types of medicines.
Yes.
So are you saying that most times maybe just one or two would have done
Absolutely,
the work?
absolutely. It is very, very uncommon to find that someone will need more than 5, even more than 3, even 2 types of medication to treat a particular ailment. But in this country, there seems to be a culture of trying to make sure that we give as many different kinds of medication to treat somebody. And that also contributes to the instances of stockouts at the health facilities. Because if I give you 10 different types of medication, of which you only needed 2, what happens to the person who comes after me?
Yeah.
And we're all operating within a resource envelope, which we get from the Ministry of Health, which is fairly static. And we have to make sure that we treat the people within that envelope. So that's why I said the essential drugs list is very important for us, that we try and stick to the same script, and we're all reading from the same script within the country. And we try and make sure that we are giving people what they need in a cost-effective way.
Okay.
Yeah.
So I see a lot of boxes and 30,000 pallets.
Yeah.
Are you saying that you sit here and decide what Mulago is going to get? Which type of medicine Mulago is going to get? Which type of medicine Chana Mkaka is going to get? Which type of medicine Kazo is going to get? How do you arrive at which facility gets what?
Okay. There is a very important aspect in this operation that is handled by our client services department, that of the forecasting and quantification. Every single medicine you see inside here has arrived here after following a very rigorous process of demand forecasting. We, together with the Ministry of Health, try and estimate what we think will be the needs in terms of essential medicines.
How do you do the estimation?
This normally is dependent. There are many ways that we can do this. The most effective one is consumption data. What this means is that I would go to a health facility and try and get data from the records they have there of the number of patients they have had within a particular period, say for example a year, and then estimate that if they have a population of say 1,000 people they were treating, and they got 100 people, say for example, presenting with similar disease, we can expect that next year they will have a similar figure. You can factor in some sort of increase or decrease, but at least we know somehow the kind of prevalence of that disease in that area. And we take that for one health facility, do the same for all the more than 3,000 that we have, and then come up with an aggregate figure for the country. We can then determine, using some models, the extent to other interventions that we may have. I may give a simple example of malaria. If we have a prevalence of malaria at a certain level and we are giving out bed nets, we expect that the number of cases may not necessarily go up, it may stay the same or come down. We will arrive at a figure that we think should be sufficient for the population for the year that is to come. So based on that, we then get in there and do our supply planning, try and make sure that we can work with the funds and resources that we're getting from the government of Uganda. Where there may be gaps, we can even engage development partners who support different programs across the country and see how willing and able they are to support us. And they normally do this in kind, and they provide supplementary quantities of these medications, and we plan with them exactly how they should be coming within the year. That is how we do the forecasting, and we do this with all the individual health facilities across the country. Now, once that has been done, we now have an opportunity to give them the chance to make the orders. And now we introduced NMS Plus very recently, and we have a module in there called CSSP, the Client Self-Service Portal, where facilities now have an opportunity to order for the commodities they need based on their current demand. So initially we would have done a forecasting where we think we have the right kind of numbers to serve the whole country, and now we give the facility the opportunity now to order for the demand that they see prevalent in their areas at the time. So we expect that the average across the country will balance out, but through execution in the year, you find that some areas may get more cases and others may get slightly less. But that is how we arrive at quantities that we plan to procure and receive here in the warehouse. So everything that you see inside here has come for the sole purpose to go to a health facility, but we also factor in a certain amount that we want to hold here as buffer, just in case there is a disruption on the supply side and we may not be able to quickly get commodities that may be necessary, maybe because of an upsurge or challenges in manufacturing, either in the country or outside, or in case we have fluctuations in demand where we may have an increase in demand that may be quite urgent or on short notice. Then we can call on the resources that we have here. So it's a delicate balancing act that we do inside here to try and make sure that we maintain an inventory that is sufficient to make sure that the country always has sufficient stocks of essential life-saving commodities.
There's been an issue around the health kit.
Yeah.
The health kit, the basic kit.
Basic kit, yes.
The basic kit that we force, as NMS, we force medicine on the health center tools. Can you just clarify that? What is a basic kit anyway, in simple terms?
The inventory hold here is quite significant in terms of shilling value. Many times in excess of 1 trillion shillings. It would be very irresponsible of us to force medicines down on people, knowing that there's a chance that they may actually not be consumed. We would rather hold them here and wait for orders to fill out those requests from health facilities. But what we've done with the health center 2s and 3s is an innovation to try and make sure that they get their orders on time. And we've done this to mitigate the challenges we experienced earlier in failing to get orders in time from these levels of care. They provide basic care to communities around them, and sometimes they may not be adequately staffed with people who are versed in pharmaceutical quantification and may not even be well acquainted with the systems available for ordering commodities on a regular basis. So what we do for those levels of care, 2 and 3, is sit down with them and their DHOs, look at consumption data, which is our primary data that we are using for forecasting in this particular instance.
How often do you do that?
That is annually done.
Yeah.
It is done every year. So we derive quantities from that exercise that we call procurement planning with them. We arrive at quantities that we expect will make sense for them in the period ahead, which is a whole year. And we break those quantities into deliveries that we shall be making every 2 months. So that standing order that we agree with the health facility and the district leadership is what we call the basic kit. So in these instances, we don't have to wait for all the health facilities within a district to actually place orders with NMS. We already have a standing arrangement with them, a standing agreement with them, a standing list of items that they've requested that we call the basic kit that we provide them on a regular basis. It can be amended, but we want that to be in writing. But what we don't want is to deny an entire district medicines because we are waiting for one health facility to finalize quantification. So what we do here is provide our expertise earlier on in the year, sit down with them and go through the numbers, use some of the models that we have for quantification so that they can at least appreciate how forecasting in pharmaceuticals is done, and then arrive at quantities that can be reasonable for them to function. Not necessarily only medicines to treat diseases, but other sundries and things that they use within that health facility to offer a service.
NMS has 3 mandates, which is to procure, store, and distribute.
Yeah.
We've kind of talked about the storage bit. Can we talk about the distribution now?
Yeah.
How does medicine leave this warehouse to get to the health facilities?
First thing, for commodity to leave this place here, there must be an order from the facility. There must be a request. These days, we are very fortunate. We've just implemented an ERP, so this can actually be done electronically. Some years ago, we were relying on emails coming through, even fax. People would even write letters making their requests. But now, at least, we've been able to have that within an electronic environment, which means that we can get these through very quickly, and we can actually triangulate and see and validate the quantities that they are sending to us. So that is a very big bonus. But once those requests come through, the orders are verified by the client services department, who our client facing department. They confirm that these requests, first of all, are in line with the plans that we had made, in line with the guidance from the Ministry of Health, level of care and all that, but also in line with the budgets that finance has approved for them. So once they have confirmed that the orders can actually be served, they are sent down to the warehouse, the stores and operations department. They normally come through transport section first, where we now plan to have the commodities go out. Once we have identified the resources we require to have the commodities taken to the facilities, the orders are then sent down to the warehouse to be picked and packed.
Okay.
Right now, our fleet is close to 90. We are actually getting very close to having a fleet size of about 100. But we also do have arrangements with private transporters to just try and make sure we can have surge capacity just in case we need a little bit more fleet to be able to support us.
So how do you ensure that medicine that is delivered to health facilities is not stolen?
Now, we have over the years gotten experience in this sector. Some of the lessons have been very painful, but also we've tried to implement the best practice in distribution. So the key things we make sure, first of all, for the medicines not to be stolen is that, one, there is an order from the health facility. The order is in line with the budget that they have. The order is then sent down to the stores section through the transport, who has prepared facilitation to make sure they can take it, that being the truck and the delivery clerk. So once the items have been picked and packed, like we can see around here, we then make sure that we load those commodities for a consigned trip or district where the commodities are actually going. These commodities that are going out, especially the ones which are procured using Government of Uganda money, have very clear embossing on them. Government of Uganda, not for sale. We've had instances in the past where we have received reports and confirmed them to be true, that some medicines which have gone through our distribution network have found themselves in private facilities or private pharmacies and are actually being sold. So government took a decision almost 12 years ago in 2012 to make sure that we emboss all the commodities that we procure using taxpayers' money. So it's easy to identify. So that makes it easy for us to know if items have leaked and gone out into the private sector or are being used for any other purpose other than they should be. So that protects us in a way.
How can I, as a Ugandan, ordinary Ugandan, know that this is a government medicine or this is a private medicine or drug?
I think we have a tendency, once we get the envelope from a pharmacy, we keep the medicine in the packet. We rarely look inside or read the lettering on it. But I think what we're saying here is that we should encourage everybody to look at the medication that you have been given. First of all, if it's come from NMS here and it's been procured using Government of Uganda resources, you will find clear labeling on the secondary packaging and primary packaging, Government of Uganda, not for sale. Then immediately you should know that you should not be paying for that commodity. But also there is another important thing. There's also a chance that you may have been given the wrong medicine. So it's always important to read the name of the medicine that you are actually taking. You may take something accidentally and actually compromise your health even further. So again, the culture of taking interest in one's health, not just taking medication and going home and swallowing it and then drinking water. You ask, what medication were you given? They gave me some tabs. They told me take it twice a day. No, I think we need to be a little bit more involved in our health. Make sure you take the time to actually read it, look for an expiry date so that you know that the medication you're taking is still good. Earlier, I had spoken about our efforts in making sure that we emboss all the medicines that we are distributing through our supply chain. We also try and encourage partners who give us commodities in kind to mark their medicines, especially if they're giving them not for sale, to say this is a donation, not for sale. It's very important when people can easily read and see that these commodities were not intended for sale on the open market, so that they can get them for free, because the cost already has been paid. So one of the other things we have been very deliberate in doing is making sure that our delivery clerks, staff of
Who are
NMS here,
those? What are delivery
delivery
clerks?
clerks are employees of NMS that we assign to commodities that are going to health facilities of all levels of care. So we try and make sure that we maintain a chain of custody right from the point when commodities are leaving NMS up until they are delivered to health facilities across the country. That is a very, very important aspect of our distribution network here, maintaining that chain of custody. So whereas our commodities will go out in our trucks, may go out in a 3PL truck, may even be resident in a district store or any other store, we try and make sure that we have an NMS individual employed by us accompanying these commodities all the way up until they are delivered. So they deliver these commodities to the health facilities and verify them with the people there and just confirm that all the commodities we dispatch from here have actually been received in totality. And if there are any deviations from what is stated on the delivery note and invoice, those can be recorded and we can investigate as to why they're not there. But for the vast majority of the commodities, we see that they arrive in full as they were dispatched from here. There may be breakages on the way, I think, which are expected. But what we'll try to do is make sure that we are responsible for any leakage that may happen if it does. And we have staff we have employed to make sure that we can have custody of those commodities until we have passed them on to the health facilities for whom we intend to create value.
Okay, so I know that there's been a lot of concern again on theft of medicines.
Yeah.
What would be my role as a citizen, as a Ugandan, to protect, or what role can I play to ensure that medicines in my health facility are not stolen?
When we send commodities to these health facilities across the country, we know they are meant to treat people living in a particular community. We know that the productivity of that community, their contribution to the economy, is directly correlated to the health of those persons in that population in that community. So they have to take an interest in making sure that they have health services within their community to make sure that they can stay healthy. We have parents there who must provide for their young children. And if you are not healthy, it is very difficult for you to remain productive. So, yes, you must take interest. And I think everybody must take interest. But now the issue is, how do we take interest? We have mentioned that we've made efforts to make sure that these commodities are embossed. So if people are literate and can read and can identify markings that we always have in red on those commodities that state that these items are supposed to be provided free, they should not accept to pay for commodities like this. And because, again, this theft of medicines is happening within the community, I think it is very important that the local leadership take interest. If you see issue like this, please make sure it is reported. Have the leadership investigate and find out exactly how these items are either being sold or being denied to somebody, which is almost the same thing, when they actually need this care. It's very important that we find means and ways of making sure that as government continues to increase its contribution financial to procure these items, that actually translates into more people getting these commodities. And we are not having a bottleneck at the health facilities or within the supply chain where we deny people services they should be getting for free just because of the interests of a few people. Okay. So yes, we're saying this must be reported. The police is a group that we work with a lot to try and make sure that we apprehend culprits who have done things like this. The health monitoring unit are also very, very interested in making sure that we don't have any vices within the health sector. They are very interested in making sure they can investigate some of these issues, and where they find that people actually deny people services either deliberately or by not revealing commodities that are available or services, they are taking action. And I think that is very important. We are creating a culture where people do appreciate that, yes, our government is trying to do something for them. They also have to do their bit and make sure that, first of all, they try and live healthy. But in case they fall sick and they go to a facility, there is a minimum standard of care that they should expect there, and they should demand it. And if it is not provided, an explanation must be given. And that's why the leadership is there. So we want everybody to be as involved as possible. One of the means we're also trying to make sure we can support this initiative is, again, through our new ERP, where we have digitalized a lot of what we do within the supply chain. We are sending now information downstream, and if they are interested in finding out the commodities that we have provided, and very soon we shall actually be providing them portals where they can actually go in and check commodities we have delivered to a health facility, they can be able to do that.
Is that for citizens?
No, for the health facilities and the leadership there,
Oh,
so that they
the
can take
leadership.
more responsibility for commodities that they are receiving, financed by government of Uganda or even supported by partners.
As a citizen or as a Ugandan in the village somewhere, do I ever get to know when NMS has delivered, or do I just walk in and I'm told there's medicine or there's no medicine?
Yeah, I think the easiest way to first of all know if NMS has delivered medicine is to see the NMS truck drive into your village or your community. Our trucks are very easy to spot. They are well branded. We have messaging on them. So normally, when you see them in your area, you must know that medicines are being delivered. But what we have also tried to do is disseminate information, especially to the leadership, letting them know when commodities have left NMS.
By the leadership, you mean who exactly?
The political leadership and the in charges of the health facilities, because they're the ones responsible for service delivery at that level. So what we have done is develop a system, we call it the DMT, Delivery Management Tool, that sends them prompts each time commodities are dispatched from NMS, when they arrive at the district and when they're delivered at the health facility. So at least the leadership is in the know. For the people on the ground, their knowing of when medicines have arrived is a little bit different, because I think for them, the service we're trying to offer them is for them to go to the facility and always find the commodities.
Because otherwise you'll deliver, but then I'll go to the health facility and I'm told there's no medicine. How will I ever know that
but I
NMS
think,
delivered and I'm being lied to? Or
I think what
it's
we don't
genuine
want,
that they
what we
didn't
don't
deliver?
want to create is a situation where people plan to fall sick when medicines have arrived. I think that is also something that we are starting to see.
Yeah.
People remember to complain of ailments when they see the NMS truck pull up and there is talk that commodities have actually been delivered. So what we want is not for people to go to the health facilities to get medicines to hoard in case they fall sick later, but only to go there when they actually have genuine health issues. The normal person in the community, we expect them to walk up to a facility and get a service, and that is what we are trying to do. We don't expect that the commodities we deliver on a day will get depleted on that day. We provide sufficient quantities to last for a 2-month period. So if somebody is going to that facility within that period, we expect that they should be able to access commodities that they are looking for.
Okay.
Yeah.
How does NMS, how is NMS able to handle emergencies or outbreaks or epidemics or pandemics like we saw during COVID, but still maintain a steady flow of essential medicine or distribution of essential medicine?
Okay. When we first had the COVID outbreak, we were faced with such a challenge. The demands in terms of the volumes required to respond to that public health emergency were quite enormous. We very quickly realized that we needed to establish a new section within the department that we call surge operations. We got a group of people whose job it was to basically execute tasks that were given to us by the ministry in response to public health emergencies, but also to projects that the ministry may be trying to execute, like the BedNet campaign. We've also done other projects for the ministry where we have been collecting and destroying obsolete cold chain equipment across the country, and many other assignments that come to us. So to try and make sure that we protect the routine delivery of medicines to health facilities across the country, we've had to come up with a surge operations plan where we try and accommodate requests that are outside our routine delivery schedule within an operation that is quite separate from routine. And it has been very successful. We have done so far 2 very successful net campaigns across the country where we've distributed more than 28 million nets in each of those instances. And we've distributed nets as low as sub-county level in the first campaign. And for the last campaign, we went up to the parish level, more than 11,000 of them. And all this we did within a 12-month period, which is quite incredible. So the level of sophistication that we see now in our surge operations is quite good. We are able to take on large volumes of either medication or supplies like the nets, and have them distributed to as low as parish level throughout the country, I think, which is quite impressive. We're able to organize this on short notice. We're able to find Ugandans who can support this operation, which is also very good. and we believe it's the future. We want to make sure that we can maintain a steady flow of essential medicines to health facilities, and then also in case there is additional support that comes to the country from the government to respond to a particular health issue, we are more than ready to be that agency that is the first call when it comes to action.
All right, so as we conclude, thank you so much, first of all, for your time. Any parting shots for our audience? What message do you have? Anything
Parting
really
shots.
that you can, yeah.
I think important for us here to share is perhaps where NMS has been instrumental in improvements in the health sector. I think what we have observed in the years that we have been here, there have been significant improvements in vaccination program. We now are one of the best countries in Africa when it comes to logistics of vaccines across the country. We have one of the best figures when it comes to coverage. And with that, it has brought us a lot of success. We have seen infant mortality reducing. We're also seeing life expectancy in the country increase significantly. We now have a life expectancy in Uganda of 62. And that success also brings other challenges for us. We are starting to see an increase in non-communicable diseases. So the type of medication people go to health facilities and seek is slightly different. 10 years ago or even 20 years ago, the type of medication people sought was very, very different because we had a very young population. We still have a young population, but we have noticed over the years that as we succeed in providing primary health care and supporting the ministry's efforts in making sure that at least there is some degree of basic health care available in the country, we start seeing people living longer, and people who live longer then start becoming susceptible to different kinds of diseases. So yes, we have been able to see the sector led by the Ministry of Health and us succeed in very many different disease areas. And we have also seen that success breed different challenges for the future. And I think what we observe and see in the future is more people demanding now for medication for non-communicable diseases, again, or which we call lifestyle diseases. So again, as responsible citizens, I think it's very important for us to make sure that we live healthy lives, try as much as possible to remain in the best physical condition that you can be. Always go for a checkup, live as healthy as you can, eat as responsibly as you can, and try and avoid illnesses for yourself and your family where you can. Because one thing we need to be aware of is that treating people who are more advanced in age is significantly more expensive than treating teenagers who will bang themselves and get up the next day. People who are in their 60s and 70s become a little bit more difficult to treat. So again, we have a population which is transiting from being purely very young. We're starting to see more older people and more lifestyle diseases increase in the country. That prevalence is something that we are noting, and that requires us to be aware of the consequences of the lifestyles that we pick. And I think as Ugandans, it's important that we try and live as healthily as we can. And I think we shall continue to see improvements in the health sector. And we believe that those improvements in the health sector will be in a large way supported and driven by the activities of the young people working here in National Medical Stores.
Okay, Paul Okwara is the Chief Stores and Operations Officer here at NMS. Again, this podcast is meant to bring NMS, and not just NMS, but the entire health sector closer to you. My name is Shilan Bushire. Please follow and subscribe this podcast on our YouTube channel. And if you like it, please share it. We hope you like it. Goodbye. Until next time. Cheers.
Very well done.